I did indeed seek out Cambridge Children's, when I was doing some work on NDD, kids with neurodivergence, and this was definitely one of the most innovative places, so I wanted to come and see it. And when I got here, I found amazing people, but I also found Dame Mary, and she immediately talked to me about Cambridge Children's, and I thought, goodness me, if you've got her behind you, this is going to happen, because I do think if we had her running the government, things might move a little more quickly. Really? Yeah. And indeed, I do, as Children's Commissioner, I have the great privilege of both seeing children's services all around this country, but also looking around the world. And I've been to, I would say, some of the absolute best children's hospitals and children's provision in the world. I mean, I was in Queensland's, Brisbane's Children's the other day. Absolutely fantastic to see their leadership of the Indigenous community and doing some of the things you're talking about in terms of leadership of other services. You know, I really want to see Cambridge Children's do that. I was in Sick Kids looking at some of their things in Toronto recently. I was even in the Bambino Gesù looking at their family rights in the Vatican. So we get everywhere. Now, before I became Children's Commissioner, was a head teacher for 20 years. I ran a trust of 14 schools. I was a teacher for 32 years in East Anglia. So I am absolutely committed to you being brilliant, because we need you. I worked in Great Yarmouth, in Lowestoft, in Kings Lynn. My schools were often failing schools that we brought in and turned around. And I can tell you that the vision that you are promoting here is absolutely the right one. And services need you. Teachers, families, parents need you, so please do keep on. Good afternoon, I'm the Children's Commissioner. My role is to protect and promote the rights of children, and naturally I apply this to all children, but I have specific duties and responsibilities to those that live away from home. Because home tends to mean there is someone looking out for you. And so I speak to children here all over the place. I sit with children in prison who've carried out the most heinous crimes. So I was with a little boy the other day who told me, I killed my brother, will I ever have a normal life? Hard question. I sit with children who arrive here cold, exploited and lonely on small boats. I speak to children in mental health wards, the most unhappy children. So of all the children, we survey them, the most unhappy, perhaps unsurprisingly, and children who are looked after by guards, not by nurses, in children's homes that are actually tents or caravans. Children who find it hard to communicate, and children who desperately want to be heard but just don't know the right way of doing that. I think a rather neat way of putting it is to say I look after children, I pay attention to the children to whom no one else will. Those that might otherwise slip through the cracks of state provision, and I'll be talking about that quite a bit today. And so I found myself reflecting on the theme of attention often recently. We hear so much, don't we, about the attention economy. I've been out this morning all over the airwaves talking about where we're putting toddlers and under 2's attention and under 5's attention and all the people trying to get that. Our attention, though, is supposedly the most precious resource we have. I worry deeply about the attention spans of children. Recently, I've been listening to children and those who care for them to understand what they think about screen time to this end, and actually advise the government. We convened scientists and hundreds of parents to try to just give parents some help with what to do about that. You'll probably be unsurprised that I said no screen time is necessary under the age of 2, but also try to give lots of ideas about where parents can co-enjoy things like looking at pictures of Granny on the iPad or listening to a story. There's a way of doing this and navigating through this that isn't about shaming and upsetting parents, but gives them much needed guidance. So today I wanted to think more particularly, though, about attention within our public services and our blind spots, really, and within our health system and the wider system around that specifically. And I think attention is a hugely undervalued concept in our services. The great 20th century writer Simone Weil, in her First and Last Notebooks, claimed, "Attention is the rarest and purest form of generosity." And I think she was right. Let me give you an example. Almost everyone in this room will be aware of just how difficult a position children's mental health services are in. In fact, we're here today to talk about how to rocket boost and transform them in this area. We can debate the causes of this ad nauseum, but it doesn't change the size of the waiting list. The last time I used my data powers to shed light on this, 3 years ago now, the waiting list for mental health services stood at 250,000 children. 250,000 children. 40,000 of them remained on that list for over 2 years. 2 years. 2 years. What worries me is that even with my statutory powers, I cannot tell you the extent or the severity of their conditions or what impact any interventions are having. We don't have that data, we don't collect that data. Sometimes these conditions might be manageable, sometimes they might not be. It's not just mental health services either. Silos in provision mean that bottlenecks knock into other systems. And while I've got some qualms about the way in which we currently conceptualise and talk about children with SEND, with special educational needs and disabilities, in my view, it's such a broad term, it's difficult. But one thing that unites everyone in this debate is a sense that the status quo is simply not working. We all know this. And so I did what I do on every issue. I went out and listened to what children had to say about it. I was sitting with a panel of young people recently, and the feedback from one of them stuck with me. They'd been on the waiting list for a while. I knew, they knew, their parents knew that they'd be on that waiting list for a good while longer. They'd accepted that. What they wanted, they told me, wasn't necessarily to be bumped up the list. I'm sure they'd have been delighted if that had been a possibility, but they didn't expect that. What they wanted was a letter or a communication, an acknowledgement that they were still on that list, and there was a sense that there was someone thinking about them. Perhaps that someone's job was to progress their case. In short, they just wanted to know, not hope, but know, that someone somewhere was paying attention. And I speak very often about how children need someone who loves them. Sounds obvious, doesn't it? And so here I'll further Vale's claim that attention is the purest form of generosity. I actually think that attention is the basis of love. It's the foundation stone on which love is constructed. Because in my view, the condition of love's absence is not hatred. After all, hatred would imply some real depth of feeling, wouldn't it? Now, I think the opposite of love is simply not caring. It's very hard to hate something you don't see, you don't have an idea of, or you don't pay attention to. And it's absolutely impossible to love it. When I think about the great failings of services that impact children, it's almost never the case that there's someone cackling evilly because they hate children, is it? It's not. It's not. Sometimes it's just a system that didn't care, that didn't pay attention. Or perhaps it did, but due to the incentives they worked under, that attention went in the wrong place. And most often, it's actually a whole host of professionals desperately trying to care, to pay attention, and running into systems that are simply not set up to allow that work. I cannot tell you how shocked I was after 35 years in education to go to Westminster as Children's Commissioner and realise just how siloed all these departments are. Nobody talks to each other. Children's social care doesn't talk to health. Health doesn't talk to justice. It's mad. And and then how on earth can anything happen underneath? So in my experience, the problem is not that we care too little. It's that we care in fragmented and disjointed ways. And for me, this was put into stark relief by my school and college census last year. So I went out and I asked every head teacher in the country. I've surveyed 1 million children, and I thought, let me talk to the head teachers. So I asked every head teacher in the country what the biggest worries were, biggest concerns were, range of questions, what professionals do you have in school, And I got 90% response rate. We've never had that before. We now know who's everywhere and what everyone thinks. It's really interesting. But for the first time, I used my data powers on school head teachers, because I've got a couple of little superpowers. One, I can ask for anyone who's got data, who's a public body on children, has to give it to me, no FOI. I can enter anywhere where there's a child that's got a public building, and I can demand a response. So I've got there my thing. So I use my data powers. But what I got back shocked me. Before I go on, I am a former head teacher. I'm a former trust leader. I love my profession and I'm certainly not blaming schools. But because we collect some data and not others, because systems don't speak to each other properly, because the incentives we hand to schools are what they are, the data came in, my staff analysed it, and a picture became incredibly clear. These institutions, our schools, don't know half as much about children's lives as they should. And you would think that they would, right? It's the closest partner. 60% of schools could not give me a number on how many children on their roll were bereaved, had a parent, were bereaved of a parent or a sibling. Just couldn't. No data at all. 43% of schools could not tell me how many pupils had a parent in prison. Let's just ground that in children's lives for a second. If you're a child in England today and your dad dies, or your mum dies, or your sibling dies, if you go through that terrible event, you cannot rely on your school to know about it. Just can't. And to go about helping you. Better in primary than secondary, but really very, you just can't expect it. If your front door is kicked in and the police arrest your father, it's up to you to tell the school. It's up to you. Otherwise, they just don't know. And there's a reflection from the American poet and that great chronicler of attention to the world around us, Mary Oliver. Attention without feeling, I began to learn, is only a report. An openness, an empathy was necessary if the attention was to matter. And she was right. Everywhere I go, I see this. And that's why this week, on Monday, I launched my Children Waiting to Leave Hospital report. I like to think at this point in my old age, I've seen it all, I've been everywhere and nothing shocks me. But this report was one of the most challenging pieces of work I've done. And I did it because of an experience I had in a hospital, not yours, hospital in London. And the chief nurse, she knew. She took me, I'd been up seeing a surgeon and she took me down to the ward. A little girl walked round the corner, curly-haired little tot this high, attached to a big machine. And she looked at me and she said, "Hi." And I said, "Oh, who's she?" And the nurse and the surgeon I was with, the nurse said, "Oh, she lives here." I said, "What do you mean she lives here?" And she said, "Oh, no, she's got disease. She could be at home. It would take her, the parents, a bit of work to work out how to sort of support her, but she could be at home. The parents don't want her. Social care are overwhelmed and know she's got safe for a bed here." And I said, "Yeah, but she's 3. She'd never left the ward, never been stood on grass, never been to nursery, never been outside, it's just shocking, just absolutely shocking." So obviously, I did what I would do, which is I have an advocacy team and some barristers, and I'm sure the Chief Nurse showed me that on purpose, and we took proceedings and got it sorted. But, I just thought, are there any more like this? So I decided it was time to get the data. Many of the children spending long periods of time in hospital are doing so not because they need to, as we know, but because safe or appropriate options have not been found for them outside of the ward. Reasons for long stays included, when we looked into this, delays in setting up care packages, a lack of children's social care placements, and housing issues. It's those silos, isn't it? It's those care packages. It's children falling between them. What a shock. We spoke to one mum, and it's in our report, who for 3 years, was waiting to have her stairs up to a tiny little house, her stairs sorted to her son's bedroom. Son was very sick. He's dead now. She, in order to get him to bed at night, used to have to take his oxygen pack off so he couldn't breathe, carry him up the stairs and put it back on again. For 3 years, social care, and didn't sort that out. It's just shocking. And it's a harrowing thought. And I mean, that was just the surface of it. It's a harrowing thought, particularly when we know that many of the children spending these long periods in hospital have life-limiting conditions. And, one of the things that as Children's Commissioner, I think I should do is be the person who says something quite simple, which is, this should not happen to children. This should not happen to children, and this must change. Because there are so many voices who, and often for very good reasons, can tell you 1,000 ways why things cannot change and cannot improve. It's too hard. It's too expensive. It's not us, it's them. But this is the one occasion where I do not care one iota how hard it is. Let me be clear. No child should be in hospital for longer than they need to be because services cannot accommodate them. And it's got to change. And I've been speaking to ministers and speaking out on the airwaves about this. And I just want to apologise to all of you who've had to live with this. And we have to do something about it. Look, in some cases it's a day or two, and I understand that things can go wrong. But my report shows some of these delays in discharging children from hospital go on for months and even years. And while this is largely acknowledged, well, those working in the sector, the scale of the problems are known, and that made me furious. The data mostly isn't being collected. It's not being collected. And here's another thing about my role. As I said, I've got the most comprehensive data gathering powers in the country when it comes to children. Under the Children and Families Act, I can request any data I need to protect and promote children's rights. There is no opt-out. Only one Secretary of State ever tried to opt out. And I put her on the front page of the Sunday Times. And basically, if she hadn't left, I'd have had her to court. And it's always a Home Office, isn't it? It's always a Home Office, but it's before, yeah? If I can't get the data, chances are it doesn't exist. So let me tell you today something I found utterly shocking. Neither the government nor the health service appears to know definitively how many children are waiting in hospital to be discharged, how long they stay for beyond what is necessary, and how many bed days can be saved. This might come as a shock to many of you. It did for me. You're probably saying, yeah, Rachel, where have you been? Yeah. After all, how much time do we spend fretting about NHS capacity? You know, turn on a radio or a television perhaps from early November, alongside the carols, the trees, the turkeys. Our festive tradition now appears to involve huge volumes of discussion about NHS bed numbers. And yet, for all the attention given in the public sphere to adult hospital waiting times, adult social care and adult wards, children are rarely mentioned. Worse still, until I carried out this research, there was no record, no publicly available records of how many children are admitted to hospital in a year or how long they're spending in hospital. How can you pay attention to something you don't know about? How can you care in a way that matters? And this is truly what I mean when I talk about attention. Singular and sustained focus. And this is why children's hospitals are so incredibly important. Your hospital helped me with this work. And you knew your kids and you were able to tell me about what to do. They allow for a space, Children's Hospital, where the child can be the focus. During the course of this report, I also heard about how children's hospitals are utterly transforming lives outside of clinical practice and operating theatres. I heard about how staff from children's hospitals moved heaven and earth for the families that they were helping, smashed through the obstacles too often put in their way. And that's why I'm so pleased to hear about the wider work that this hospital intends to do. I've heard about the impact it makes. As part of the research for this report, I spoke to staff and patients at a children's hospital in the north, and I heard something that will stay with me. A child was being discharged. That child was disabled and had complex medical needs. I spoke to their parents, and the parents said the house just wasn't fit for them to go back to. It needed to be renovated. The kitchen in particular needed work. The Housing Association had offered a paint package, but nothing else. You see, council homes don't have to replace kitchens less than 25 years old. They told me the drawers fell apart when you opened them. Can't imagine how stressful that was. They told me they'd been looking at second-hand kitchens, determined to make it work no matter what. And then, staff from the discharge team came in, dealt with all of it. The builders donated a kitchen with safety flooring. Painters donated extra colours. You could see the colour had returned to their lives as well. It feels, they told me, it feels like it's going to be home. Stories like this are what gives me hope. It's what we should be aspiring to, because too often children are losing out on the innocence of childhood, and parents, instead of just getting to be mum or dad or enjoying the ordinary daily moments of family life, are taking on difficult long-term carer roles without the community support that they need. Put aside how difficult having a sick kid is. The worry, the stress, Just consider the practicalities. Parents may live far from the hospital. It might be that you live in a rural part of the country and the care of a child needs is only available at the Alder Hey or Great Ormond Street, and you're 4 hours drive from those. That's why I so, for East Anglia, need you. We need you. It's going to be so good. They might have other caring responsibility. The squeezed middle generation with sick kids, lots of kids, adults, older parents, 1,000 demands on their retention. And the same goes for clinicians too. And so too often, the things that add colour to life, the spark of everyday joy, the joy that flames out from smiling children, those are the first things to go. We focus on the physiological needs, and I understand why, of course, and it's so impressive, but understanding and accepting are not the same thing. Professionals and families both told my team about the importance of play and activities for children living in hospital, children talking about weekends of boredom and nothing to do. Both raised concerns that among the examples of brilliant practice, like external trips or in-hospital cinemas, there were many long empty hours for children on the wards. As a clinician told my team about a family they worked with, this mum's 2 children have virtually had to live in hospital because we were not able to provide enough support for her to always be at home or in a safe place that allows them to be out of here. And all the mum has wanted to do for a second child is have a better quality with her and not be constantly stuck in hospital. And the mother of a child in hospital told us clearly, a child is still going to, no matter how sick, they're still going to want to play, they're going to want to learn something. As a head teacher, they're going to want to learn something, yeah? And we need, that's so important. Some of the good news I heard in this vein was remarkable. I asked a clinician what they thought the best innovation in their sector was. They thought for a moment, so what's the best innovation in your sector, clinician, for children? I wasn't expecting this one. They said, wetsuits. It wasn't what I was expecting to hear, I'll be honest with you. But no, they were clear. My patients now have wetsuits that they can wear so they can go to swim. They can do things they never have else been able to do. Before, they would previously thought they were going to get an infection. They can go on holiday. They can do all the things that 20 years ago they wouldn't have been able to do. And so I look at the choices we face as a country where the advances in science and hospital care have changed the outcomes of thousands of children. It's always amazing. I go around children's hospitals and I'm looking at things being done in utero and lives being saved. It's amazing. Yet, as a country where a lack of investment in children's community and social care has left both families and facilities on their knees. And yet, as a country where we cut local authorities' children's services to their knees and they're just not delivering. Children's social care leaders talk of a severe lack of options to accommodate vulnerable children in their care, forcing them to pay extortionate costs for poor quality, often illegal placements. Just to give you a sense of that, about last year, so again, I got the data, 770 children last year in illegal placements. I think it was like unbelievable, over £1 million placements each. We were talking about billions of pounds that could actually, with proper planning and people to do it, could actually be taken on. We're wasting a fortune, and that's just in 1 year. It was billions. So school leaders have told me they're deeply concerned about the gaps. It was 350 million, that's the truth, because I was trying to remember it. 350 million, and it was 350 million the year before, on 770 illegal placements. What could you do with that money? What could you do with it? School leaders have told me they're deep, and that is the security guards, the hiring places, it's ridiculous. Totally ridiculous. School leaders have told me they're deeply concerned about the gaps in support from wider community services, deeply concerned that schools have been left to do these gaps their own. So the question for policymakers, as I come to, is to grapple with now, is whether we continue to expect families and hospitals to shoulder impossible burdens of care, or whether we build the coordinated, compassionate system children deserve with investment to match. Now, I call for various things in this report I'm talking about, but the most crucial in my view is this. The government needs to improve commissioning between health, social care and education to provide care for children with the most complex needs in the community. This should enable proper planning of support for these children, facilitate joint working, and ensure some of the most vulnerable children are smoothly discharged from hospital into the community and supported no matter where they live. A very good starting point for all of this is a brilliant new regional children's hospital. And that's why I'm thrilled to see and hear about the work you're undertaking here. For instance, the regional end-to-end pathway for children with acquired brain injuries. I know that means children will more quickly get their needs met and be discharged home sooner. Now, there's a tension in my work, and it's one I think about often. It's that children are simply not a monolith. Even subgrouping them isn't effective. I began by thinking about attention. I want to close by doing the same. What we pay attention to shapes not just what we see, but also how we see the world. The really rather charming Richard Curtis film, About Time, I don't know if you've seen it, makes a virtue of this point. The protagonist, given the chance to live every day twice, lives each day first with all the tensions and worries that stops us noticing how sweet the world can be. But the second time, noticing. Walk down a street and pay close attention to the architecture. Walk down again and consider the nature you see. The third time, consider the lives of the people who live or work there. Each time you see the street completely differently. Where you choose to put your attention matters. And I say this because attention's been a very real theme of my life for the past 5 years. I pay attention to those children the system fails to see. And too often, as Children's Commissioner, we hear stories of failure. And my role was set up in response to failure, to Victoria Climbier's terrible murder at the hands of those who should love her the most that all the systems failed to see. We tried to see the children we pushed to one side, those who have no one to care for them, children who are sad, who are sick, who are in hospital, who won't see home again. I've been Children's Commissioner at a time when the nation has let children down. And there's a version of my role, and a version of me, I guess, that could be professionally angry, that points to a litany of failure. But anger itself, should it allow to go on long enough, can become a sanctuary, a familiar place that's too easy. So I choose not to. When I focus attention on failure, I only do so in the spirit of seeking a greater good. We always focus in my office of things can be better, systems can improve. And it's days like this, events like this, projects like this very hospital that remind us the future can be bright, that things can be better. When rather than settling into the comfort of mere outrage, we acknowledge the world as it is, and we dare to strike out in the uncharted waters of the world as it could be. It's my hope that you never stop exploring those waters. And I hope all of you in this room will go on during this event and beyond seeing public infrastructure like this for what they are, manifestations of the common good, manifestations of the hope we're talking about today. I'm going to close with a line from the great poet Seamus Heaney. It's perhaps slightly more unscientific than an upcoming clinical setting might presuppose, but it captures the spirit and hope that I really believe this hospital will represent. So hope for a great sea change on the far side of revenge. Believe that a further shore is reachable from here. Believe in miracles and cures and healing wells. In all that you do, never lose sight of that. Never cease to believe in the further shore. Thank you.